Great. Okay, so now that we are all seated very comfortably, I think it's time to tackle a very uncomfortable topic, which is future-proofing healthcare. I was going to start the panel with a monologue of myself, but I think you've heard enough from me, so I would like to pass the time to some of the experts on the panel. Maybe we can open up online with Prof. Adeeba first on, from her perspective as a clinician, as an educator, what does she think about future-proofing of healthcare? Prof, if you don't mind, you can take it away with your opening remarks.
Sure. And firstly, thank you very much for inviting me to be on this panel. And I apologize for not being able to be there with you. I had every intention to be there, but just got a slight family emergency that keeps me here in KL. Well, I think there are two things that we need to consider about future-proofing the healthcare system. Number one is, everyone's talking about pandemic preparedness. We're still living through a pandemic, and everyone's saying that, we will see another one. Hopefully not in my lifetime. I've lived through two pandemics now, HIV and COVID. I don't necessarily want a third, but we have to be prepared for a future pandemic. But at the same time, we also need to deal with the increase in NCDs and also the aging population the world over. So we have what Hans Klug from WHO Europe recently called as having to prepare for a dual track system for both those challenges that are before us. And from my point of view, like you said, I'm a clinician. I also do public health when it comes to HIV AIDS, and also as an educator. I think number one would always having to have the right human resource, future-proofing healthcare professionals and the health workforce. And of course, in our region, I think nearly all of us suffer from acute and chronic shortage of healthcare workers, from specialists to super specialists to allied health and nursing, and so we have a great challenge to try and produce kind of the traditional health workforce that we're already so far behind in producing, and then we have to meet all these new challenges. So how are we going to do it? And I think there are several ways. Of course, with the advent of digital technology, I think some of our tasks can perhaps not be replaced, but be made more efficient using digital health. And there are other experts in this room who can speak to that. But also, I think we have to think of the task shifting, what we call task shifting, community health workers that are already providing essential services, but often are not recognized as a formal part of the health system. And I like to quote my colleagues in sub-Saharan Africa who've been doing a tremendous job of delivering antiretroviral therapy to millions of people. If there's any place on earth that have severe shortage of health workforce, it would be sub-Saharan Africa, right? But in the last decade, they've been able to deliver millions and millions of antiretroviral therapy to millions of people. So how do they do it? It's by strengthening community workforce, by having, by training them, by having a framework, by adequately paying them, and accrediting and so forth. And I think that's going to be essential, whilst at the same time we build the sort of the traditional infectious disease specialists and neurosurgeons and also in preparation for the aging and population NCDs, allied health, district nurses, occupational therapists, physiotherapists, medical social workers, also in very short supply in our region. And finally, we also need to train our health workforce in data science, in bioinformatics, if we're going to be utilizing genomics for health, for example, for surveillance, for new diagnostics, etc., that's another kind of new specialty in terms of the more high-tech parts of the health system that we need to build. So I think all in all, we have got a lot of work to do, but I think if we look at the different categories of health workforce, plus some innovation, we can prepare ourselves for both another pandemic and the aging population and rising NCDs. Thank you.
Thanks, Prof. I think I caught a few keywords in your speech. One of them being digital transformation, the other one being a aging population, also in terms of the skilled workforce and training of the community-based partners. So I think it's a good segue into Ms. Kong. So Ms. Kong, it's a pleasure to have you with us. And I think want to understand from your perspective, how does the industry see in terms of future-proofing healthcare, solutioning the aging population? How does digital transformation play an important role in all of this?
Right. Thank you for the question, and thank you for having me on this panel. Aging population is exactly the reason why I started EduTech back in 2014. I was looking at the math of our demographic, and we have 300 million elderly just now. So we really need more efficient healthcare systems, not just sick care, but also healthcare. So when back in 2014, when I look at the system, and we need a better efficiency and a better way of doing things. So I spent the next 5 years setting up the one of the largest data processing application platform, and it's being used now widely in 26 provinces. So we work with hospitals, and they buy our system, and we store the system there in their private cloud, and they use it for research, hospital management, and it's good to have a raw data which is uncomputable to be used in a computable way, and then you see physicians working with those data, and they can do research, they can have a better view of the patient, and also they can conduct clinical trial more efficiently, so we had a great ride since 2014. And so we have three key businesses. One is our infrastructure business, which we work with the hospital. And the second one is our CRO business, which we conduct a lot of clinical trials, for which we work with the pharmaceutical companies, biotechs, and so on. And we also work on an insurance company, work with to provide affordable insurance. Now we're the largest affordable insurance operator in China. We operate in cities like Beijing, Jiangsu, Fujian. And we've significantly lowered the cost of operating those insurances, because we find 40% of poverty in China is caused by healthcare. Right, so having those affordable insurance for for those people will be very, very helpful. So that's Edu, and started from aging and thinking about healthcare, and that was my journey. Now I am in Brunei, and we have a great joint venture with the Brunei government, and hopefully our technology, with the help of our international partners, that we can benefit more region around and provide more affordable healthcare and in the region.
Thanks, Ms. Gong. I think I heard a lot about our CRO business in China. And I think fundamentally, what you have always said is that you try to go up to the root of the problem, which is to solve supply chain issues. I think we can come back to that later. pass the time now to Dr. Hazri. So Dr. Hazri, from an educator perspective and in education for a good part of your career and spending some time in Ministry of Health, I want to hear a perspective of how can education play a role in future-proofing healthcare?
Thank you very much, Dr. Hong Shen. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon, everyone. So one of the key critical success factors for towards achieving what you call future-proof healthcare is, apart from technology, is actually the people. We need the right talent, we need the manpower, healthcare workers with the right qualities in order for us to go through the crisis, for example, as we have seen throughout the pandemic, COVID-19. So with that in mind, I think the higher education plays a very important role because we are the main suppliers of health professionals, especially EVYD in the country. And the term future-proof is the current buzzword even for education. It's trending. Simply because the world is changing, it's very unpredictable, very hostile. Education landscape is changing, students are changing because we are looking at different generation here, the TikTok generation, for example. How can we actually engage them in the classroom, for example, when they only have, for example, 5 minutes attention span, and the classroom is changing because of technology and all that. So, Alhamdulillah, this year, during the convocation of UVDs 2022 this year, our Chancellor, His Majesty the Sultan of Brunei Darussalam, through his great leadership and vision, he himself has called upon for the higher education to remain relevant, and he used the exact term, to remain future-proof. How can we be future-proof? And he called upon for UVD to start reviewing the curriculum in order for us to remain relevant. So just to share with you, even the nature of work is changing. I think we all know that. 65% of our current student at the moment, they will be taking jobs that have not been invented yet. And more than 70% of jobs that are going to be available in the next 10 years will require some technology skills. And apart from technology skills, we need to make sure that our generation are able to be taught other skills, for example, adaptability, critical thinking, resilience, grit, and all that. How do we actually embed those skills in our curriculum, especially at the university level? It is very challenging. So we are constantly reviewing our curriculum to ensure that we are able to produce future-proof graduates and, of course, future-proof healthcare professionals in the country. So maybe I can share with you probably one or two initiatives that we have done in the university this year. For example, we have introduced a new degree program through our new School of Digital Science, where we are now offering a degree which is called the Bachelor of Digital Science in Applied Artificial Intelligence. It's a 3-year program, which is different from our normal 4-year program in UBD. This is a collaboration with Coursera, which is the largest online platform provider in the world. It's a blend between hybrid and physical learning, where the student will, at the end of it, get academic certificate, and they will also have the chance to get professional certifications from big companies with the like of IBM, Google, Microsoft, Amazon, and so forth. And they will also spend about a year where they will be sent for internships or community projects, doing real life problems and looking at real world solutions. So this is one of the innovations that we have done in the university. However, the challenge for us now is, as I mentioned just now, the new generations probably are now more interested in skills rather than degree certificate. Because I know some companies, especially in the US now, they are not so concerned about getting a degree certificate. They're more concerned about skills. So the challenge for us in the higher education is how can we remain relevant, right? How can we still be able to cater to the needs of the young generation? Are we able to create the content that is relevant to them? So comes to the issue of lifelong learning now, because they tend to prefer to come and go. They are not interested to be bounded by rigid curriculum. or time-bound, let's say 4 years or 3 years, maybe they are interested more towards personalized learning or individualized learning. So this year, UVD has endorsed this new rules and regulation for lifelong learning through our Center for Lifelong Learning, where we are offering micro-credentials for adults, even those from outside the universities. And they are able to take micro degree and micro master. So with that, we are going to launch, inshallah, by January 2023, a new program, which is called the Master of Digital Public Health, starting this January. It is on a lifelong learning mode. So it is developed together with University of Michigan, Ann Arbor. So some students, the student will be able to get certificates as well from University of Michigan. And we offer modules that can focus on digital, on public health and digital health. And they can take modules ranging from, for example, behavioral science, predictive analytics, data science, mobile application and design, machine learning for healthcare professional, and so on. So this is where we actually allow the student, especially the adult or the healthcare professional, to come and go to the university without leaving their jobs. So the certificate, the course is valid for 10 years. So they can do it up to their own pace, at their own time. And it's more affordable, to be honest. Thank you very much.
Very interesting. Dr. Haji, I think during the MOU signing, you also mentioned a little bit about working with EVYD to come up with real-life sort of applications for your students to then apply some of the skills that they have learned. And I'm interested to explore that a little bit, but I heard a little bit about partnerships. And I know that Prof. Joseph's work in COVID-19 involved a lot of partnerships within the government sector as well as academia. So with that, I think we can now nicely segue into Prof. Joseph's opening remarks. Prof. Joseph, please.
Sure. Hello, everybody. Thanks for having me in this conference. So I'm a data scientist and also an epidemiologist. I work closely with the government in Hong Kong and also health agencies such as the China CDC on COVID responses. So I'll be speaking from that perspective. And looking back at, in the past 2 to 3 years on how the world has been responding to COVID, we have several important lessons learned, in particular, sort of identifying our strengths and weaknesses in terms of pandemic preparedness and response. For example, on the technological front, the global scientific community has collectively risen to the challenge of COVID-19 by innovating and deploying in real time a wide range of collaborative tools and platforms to facilitate pandemic responses. Some prominent examples include the COVID-19 dashboard by Johns Hopkins, which has been the mainstream dashboard that almost everybody around the world would go to if they want to look at how many cases have been happening in different parts of the world. And also the GSAID archive, which was originally, before COVID, designed to maintain a genomic repository for influenza, but has been adapted for COVID. And again, it has been the world's most reliable database on how, for example, different variants of concerns have been emerging in different parts of the world, and what genetic mutant might come next. So on the technological side, obviously we are now much stronger compared to the past pandemic that we have had before COVID, which was in 2009, the human swine flu pandemic. Back then, we didn't have the digital technology that we have today, which allows us to, for example, very accurately track the mobility of different of human populations across different parts of the region, and that is important for predicting, how the disease might spread from the epicenter to other parts of the world. And that was exactly what colleagues and myself did when COVID first started from Wuhan. So at that time, what we did was using the human mobility data provided by Tencent, we were able to make a conclusion that the actual outbreak size at that time in Wuhan, which was the epicenter, was at least 10 to 20 times larger than the official number of confirmed cases. And because people have been moving around the country, it was Chinese New Year back then. So even though there were just a handful of cases happening outside Wuhan in other parts of China, we predicted that there were actually, maybe a couple of hundred of cases happening already. It's just that we, in major cities of China, it was just that we haven't seen those yet. So in order to prevent those small outbreak from growing into bigger outbreaks like the ones that we saw in Wuhan, we strongly recommend very stringent social distancing measure, which was exactly what the Chinese government did at the beginning of COVID, as you all might remember. So that was made possible by again the human mobility data provided by Tencent, which again was not something that was available in the past pandemic, 2009. And obviously, we also had substantial advances in medical technology. The world was able to produce safe and effective vaccines with different technological platforms, including the conventional inactivated virus platform and also the newer mRNA technology platform. And all those from isolation of the strains to actual deployment of the vaccines in the field took less than 18 months. And that was something. This was something unimaginable, before COVID. Again, rolling back to 2009, if you tell somebody back then that we would be able to produce a pandemic-specific vaccine within 9 to 12 months, that was an unbelievable statement back then. So that's something that we have grown stronger, in the past decade. On the other hand, in contrast, as we have witnessed it, especially during the beginning of the pandemic, leadership has been oftentimes suboptimal in terms of how different governments respond to the emergence and spread of COVID-19. Also, lack of coordination across different governmental agencies, and also inconsistent risk communication with the public. All these, again, rolling back to 2020, have seriously undermined the pandemic response, especially at the national level in some high-income countries, including the States, which was, again, before COVID-19 was unexpected because the WHO has been performing annual exercises on assessing, how well prepared different countries are to future pandemics, and oftentimes, back then, high-income countries score very high. But when COVID emerged, it was almost exactly the inverse of what was expected before COVID. The States didn't respond that well, neither did the UK. In comparison, actually, some of the middle-income countries responded very well, including Thailand, including some smaller countries in Southeast Asia. So I think that is something that was unexpected, and in retrospect, it was unexpected. But then now, when we look at how much conflicts are happening both across different countries and within countries, I think this is not going to be a one-off event. If in future pandemics, I think this is also something that we need to work on. Otherwise, we'll be sort of just repeating the same mistakes that we've made in COVID-19. So perhaps the most important lessons learned from our experience with COVID-19 is that the disconnect among policymakers, practitioners, and scientists must be remedied in order to align evidence synthesis with public health operations and policies. So handing back to the chair.
Thank you, Prof. So I think you mentioned a little bit about the alignment between public sector, private sector, and private sector being industry players, public sector, government, academias. And I think this is the time where I also would like to understand from Ms. Gong's side. I know you've done a lot of work in the supply chain area, so wanted to hear on how a private company can tackle supply chain issues in terms of drug discovery, shorten time to market, and also how do you leverage technology in all of this?
So we have a network of hospitals that we work with in China. I think more than half of the top 150 hospitals in China work with us. Once you have an infrastructure, when we conduct clinical trials, you can do things like intelligent patient recruitment, trial designs, early drug discovery, and as well as intelligent execution. So those things are enabled because of technology, and it gets faster and faster, and hopefully that will shorten, the between the distance of molecule to patients. And we also worked with Hainan government to set up the Boao real world studies platform. And there are a lot of FDA approved drugs that is not being approved in China. And we want to, but for a lot of the rare conditions and the severe conditions, the patient really needs those drugs to be, to save life. A few months actually matter. That's why we set up the infrastructure for real world study in Boao, and the FDA approved drugs, but not being approved by the NMPA, can get into Chinese market through this program. And so we try to do a lot of things like this. The essentially is always to make healthcare cheaper.
Thanks, Ms. Gong. And I think it's related to what Prof. John gave in the lecture on regulatory earlier. And so hopefully there can be interesting conversations that come out of it. Switching gears to Dr. Hazri. So you mentioned a lot about transforming the way that education is delivered in terms of future-proofing the workforce. So in the pandemic in particular, would like to find out, what did the educators play? What role did an institution like EVYD play in the COVID response in Brunei?
Thank you. So I was not in the university during COVID, but I understand from my colleagues that quite a number of initiatives or efforts were done within the university and Ministry of Health, especially apart from opening our vaccination center in the university, where our student, our staff actually come together and help the national drive towards vaccination, the population. That's one. Apart from that, we also help the ministry work together in terms of research, COVID related. I understand from my colleague that there were about 33 projects done, completed, and probably ongoing at the moment, done with MOH, also with COVID, with EVYD, to be honest, and other agencies within Brunei and also outside Brunei. So that's one example where we actually help together, work together with the ministry for research. And I think that is very crucial because we have the expertise, the scientists in the university who should then work with the scientists from the Ministry of Health and other agencies there. So just to share with you also that we now have this digital health research cluster in the university. And then I understand that in the Ministry of Health now they also have this digital health unit. So we look forward to actually to work together with that unit for further research and collaboration, including with EVYD and also with other relevant stakeholders in the country.
Thanks, Dr. Hazri. I believe Pengiran Dr. Azmi is in the audience, so maybe you guys can link up later on the digital health unit exploration. So to Prof. Joseph online, I think Dr. Hazri mentioned a lot about research and working on real world problems. So I understand that you were in the thick of fighting COVID-19, and what are some of the challenges that you face in terms of leveraging your expertise in modeling, statistical modeling, in the combat of COVID-19? Because I think you shared a little bit about some of the data problems that you faced earlier in the fight towards COVID-19.
So in order to generate, accurate and reliable what we call nowcast and forecast. So nowcast means it's just like weather, um, you know, explaining and describing what is actually happening right now. And because most, the general population are not familiar with epidemiology, so oftentimes, when we make statements such as, the number of cases, confirmed cases that we see in a given place does not necessarily reflect the actual epidemic size. That is something that is not very easily digested by not just the general public, but also policymakers. And in a situation such as a pandemic, we don't have much time to explain the science. They need to make decisions, they need information, etc. So there's a lot of conflicting needs during that phase at the very beginning of the pandemic. So that's number one. Number two is of course data gaps. Some of the data that we need in order to do nowcasting, epidemic nowcasting, is not necessarily the kind of information that the practitioners, especially at the front line, would record or would communicate. For example, for frontline colleagues who are responsible for doing contact tracing and quarantine, the first priority is, of course, to control the outbreak that is happening. So when we ask these colleagues, for example, to record some of the information such as time of exposure of certain people to different index cases, the time at which their symptoms start to emerge, etc., etc., those seemed to be of secondary importance to the frontline workers, understandably. But on the other hand, that is the kind of information that we absolutely need in order to perform the nowcasting, which in turn would be the scientific base for policymakers to determine what should be the appropriate scale of response, how much resources that they should invest into the operations. So those are some of the challenges that we face, on the communication end and also on the operational end. Over.
Thanks, Prof. So to Prof. Adeeba, I think what COVID has taught us is that there is a huge proliferation in terms of the adoption of technology. It seems like now we are so familiar with QR scanning that we can't seem to order anything from restaurants without scanning a QR code at this point.
Indeed.
So I was wondering, how does that translate to HIV and AIDS, and how does technology play a part now in the current state of things? How would you think about leveraging technology and help with patients with HIV and AIDS?
Yeah, thanks for that. And I think it's also important to acknowledge the scientific breakthroughs in HIV that has kind of prepared us for this moment. But yes, you're right. And one that comes to immediate mind is the self-testing, right? The technology involved around self-testing. It's been around for a long time. We do pregnancy tests, for instance. We do glucometer tests. But I think until COVID came along, people were not so familiar with doing self-testing for diagnostics. But now, we all do it. At one point, we were all doing it every day, right? And so the HIV self-testing technology has also been around for a long time, but the uptake has been quite slow. So, and once again, in our region where testing is not at the 95% that we want it to be. In fact, it's around 70 or maybe less. I think this is one area where we can really promote and get people tested early, and therefore then get started on treatment as early as possible to benefit from the amazing effectiveness of antiretroviral treatment in terms of longevity and also as a public health tool to break the transmission chain. So I think that that's one important lesson from COVID. The other one in terms of technology, and I don't think it's limited to HIV. I think telemedicine. Again, we in the health world are often very slow to adopt technology, unlike, say, the finance industry. Part of that, I guess, is the lack of investment. And it's been said that any discovery often takes 10 to 20 years before it gets fully utilized in medicine. So once again, telemedicine, I think out of necessity, all of us had to revert to it or embrace it. And I think it's here to stay. So like I said, well, in terms of HIV, it's useful from the point of view of those who are stable on treatment won't have to come all the way to hospital to be assessed and to get their repeat prescription and so forth. The third thing is it's also to link up to what I said at the beginning in terms of getting communities involved. Is this can be facilitated by digital technology, which can link them into the traditional health systems and provide support for health workers out in the field in rural areas, what have you. And then fourth, and I think this is critical once again in our region where the disease is highly stigmatized, that digital technology can provide awareness, education to those at risk, to what in our language we call key populations, people who may not want to come forward. And we have some examples of this both in Malaysia and Thailand, where you can order, where you can connect online and order the self-test, do the test yourself and share the results privately, confidentially, and have someone support you online to either be linked to treatment if the test comes out positive, or if you're not and you're at high risk, then link you to prevention measures and tools like pre-exposure prophylaxis. So a huge role. Those are just some examples where digital technology can really help us expand testing, expand treatment in the HIV world, so that we can end AIDS as a public health threat in
Thank
reality.
you. So I think before we allow all the speakers to give their closing, I do have one last question, and that's directed to Ms. Kong. And I was particularly interested in terms of a private-public partnership. What do you see the relationship like with Brunei as a client of yours, as well as a strategic partner of ours?
So I think our relationship with Brunei has been very long lasting, and before our IPOs, CIC, GIC, the Canadian Pension Fund, as well as BIA invested in us. Right? So that was the starting of the relationship. And during the pandemic, because our algo are used by a few CDCs in China, and so BIA called us and they said, "Oh, maybe you could help with our country," and that's how the relationships, the work started on the ground. And I think that we through the activity we find out that our technology can be used in other various regions to benefit the industry, the sector, and so we set up the joint venture with Brunei, and it has been running very smoothly. And I think the key thing with working with the private sector, between private sector and public sector, I think it's always to find the right partner who have the same common goal. And during our pandemic activity, we realized that Brunei has a very responsible government, and they do things very pragmatically and data driven, and that's where we have the similar culture, and so quickly we can start from brew health and to other activities. And so hopefully that the joint venture is we also emphasize on training the local talents to the extent even during the pandemic we send our Brunei employee to China to study and to look at our technology, to look at our platform, and so we can do the transfer of knowledge properly to the joint venture. And so we are long term, and we want to be here for a long term, for a long time, and we're committed, and we are honored to work with the various bodies from BIA, Ministry of Health, and universities, and I see a lot of activities and research and the intellectual discussions in the sector, and for the same common goal, which is a cheaper, more affordable healthcare. And that's my vision, and that's why I started EduTech. So I want to thank everybody and on coming to this conference and meeting, and for supporting EVYD. And I'm here to support EVYD. This is my first trip, international trip after 3 years of in China. So I'm hugely honored.
Thanks, Ms. Kong. So I think that nicely segues us into the closing. So Dr. Hazri, if you don't mind, you can kick off the closing with some remarks of yours in terms of future-proofing healthcare and what you have learned from the panel discussion today as well.
Thank you. So two things. The first one, we will continue at the university level to ensure that our curriculum, our teaching and learning is up to date, that we are able to produce future ready and future-proof graduates, especially healthcare professionals, even to the extent that maybe we will also reconsider the kind of modules that must be taken by all the students during the first year or second years. That may include the modules such as data analytics, Python's, climate change, the SDGs and all that. I think that is very crucial for them to be aware of what is going on in the world at the moment. That's number one. So number two is to strengthen our research collaboration in terms of the ecosystem, not just within the university. As you can see just now when I mentioned about the programs that we are offering in the artificial intelligence and the Master of Digital Public Health, it is not run by just one faculty, but it is interdisciplinary, run together with our Institute of Health Science, Faculty of Engineering, or we call it Faculty of Integrated Technology in EVYD, and also the School of Digital Science. And of course, to escalate further our collaboration with Ministry of Health, with EVYD, with other partner universities or potential universities and other stakeholders, because I think it is no longer the time where one group with single discipline looking at one solution at one problem. I think it will not get us to anywhere. So it's about now connecting together, because in Brunei we are so small, so we have to work together and then to ensure that whatever research that we do actually meet the requirement or the needs of the industry and also the ministries. Thank you.
Thanks, Dr. Hazri. Moving on to the online panelists, Prof. Joseph, would you like to summarize and close off the panel on your end?
Sure. So in this session, we have talked about some examples on how technologies have enabled us to better respond to pandemics and healthcare in general. But technology can actually be a double-edged sword. In some cases, it causes trouble. In particular, vaccine hesitancy is one area that technology has been not causing some trouble in that area. So the WHO listed vaccine hesitancy as one of the top 10 threats to global health in 2019, and and that was before the emergence of COVID. So it's not something that just started to happen since COVID. Vaccine sentiments are constantly influenced by evolving epidemiological, social, and political factors, as we have witnessed it in the past 2 to 3 years since COVID vaccines became available in different parts of the world. Even though the vaccines have shown to be clinically safe and effective, just like the vaccines that we use in routine immunization, yet a substantial proportion of population in different parts of the world are either hesitant or even resistant to taking a vaccine, including the high-risk people, such as the elderly and some of the younger people with suboptimal health conditions. Infodemics is a term that used to describe, how information epidemic is spreading in the digital world. So infodemics, particularly those fueled by digital misinformation, especially against a backdrop of scientific and social uncertainty, such as, again, during the very early phase of the pandemic, and also at the very beginning stage when vaccine campaigns began, where when people have doubts about whether the mRNA vaccines is safe, etc. That those are kind of the situation that digital technologies, for example, social media, etc., could amplify the volatility of vaccine sentiments and actually erode public trust in policymakers and health authorities. And I think the situation is not going to get better unless we collectively do something about it, not just from the academic area, but also the private industry, the tech industry, including the largest social media platform, including Facebook, etc. And I hope that in our next conference we'll be able to see some progress on that end. Over.
Thanks, Prof. Prof. Adeeba, we have you to lastly conclude with some concluding statements.
Thank you. Well, like I said, I think in order to face both the NCDs as well as the aging population and be prepared for future pandemics, we have to have both. We have to build our talent pool. We have to build the health workforce in all the different disciplines. And hopefully now that, technology has become more mature, that that can assist us in delivering health services that are more efficient and more precise, both in terms of in treatment of individual people, as in precision medicine, as well as precision public health, which Prof. Wu was talking about in terms of using data for public health good. So and others have also spoken, obviously, about the importance of digital health. Prof. Wu touched on some of the negative side of it, and I just want to highlight one other, which is all of this, advances in digitization. I think we need to be aware that we don't want to create another sort of a big digital gap between the haves and have-nots, from access to devices itself, to having networks and broadbands that are adequate, to and of course more high-end services. So I think we always need to be careful that we don't create another problem. I mean, we saw that in during the pandemic, that children with laptops and with parents with computers and good bandwidth were okay, but children from poorer families were not able to access as easily education that turned completely to digital delivery. So in the same manner with health, I think we always need to be aware that we don't leave anyone behind.
Thank you, Prof. So I think we're coming up to an hour. I would like to thank all the panelists for taking part in the panel, and I believe we've only scratched the surface of what is a massive undertaking for future-proofing of healthcare. And with that, ladies and gentlemen, a round of applause for our panelists, please.
Dr. Lim, thank you so much. And to all of your panelists, that was our final panel discussion for our conference.